When most people think about medical care, they imagine hospitals, doctors, and pharmacies always being available, but what happens if they're not? That's exactly the question behind a guide called The Home Doctor, Practical Medicine for Every Household. It's a 304-page book written by doctors that aims to teach ordinary people how to handle many common health situations at home, especially during emergencies when professional help might not be immediately available. In this review, we'll take a closer look at what The Home Doctor actually contains, who created it, and whether it might be worth having in your household. The book was developed by Dr. Mabel Nieves, a surgeon who worked at Caracas University Hospital in Venezuela. During the economic collapse in the country, hospitals often faced severe shortages of electricity, medicine, and medical supplies. Doctors had to find creative solutions to treat patients when standard resources simply weren't available. Those real-world experiences eventually became the foundation of this guide. The idea behind The Home Doctor is not to replace professional medical care. Instead, it aims to provide practical information that people can use to better understand common health situations and take basic action when necessary. The book is designed for everyday households, meaning you don't need any medical background to follow the instructions. Inside the guide, you'll find a wide range of topics covering both everyday health issues and emergency scenarios. For example, one section explains how to recognize the early signs of a heart attack and what steps should be taken while waiting for emergency services. Another chapter focuses on how to identify the symptoms of a stroke quickly, emphasizing the importance of acting fast. There are also practical guides on dealing with cuts, burns, skin infections, and wounds, including step-by-step instructions on cleaning and treating injuries when medical help isn't immediately available. The book also discusses common household medical supplies and which items can be useful to keep at home. This includes over-the-counter medications, wound care supplies, and other basic tools that can help you respond to minor health problems more confidently. Another interesting part of the guide focuses on recognizing symptoms in the body. For instance, the book explains how certain signs like abdominal pain, irregular heartbeat, or persistent migraines might indicate different underlying issues. It also introduces a basic abdominal evaluation technique used by doctors to narrow down potential causes of stomach pain. In addition to emergency care, The Home Doctor also covers everyday health topics. You'll find sections on managing toothaches when you can't visit a dentist, relieving neck and back pain with simple stretching techniques, and identifying common skin conditions such as athlete's foot, burns, and dermatitis. Some chapters also explore lesser-known remedies and historical practices that have been used for centuries. For example, the guide explains how medicinal leeches were historically used to improve circulation and support wound healing. While that might sound unusual today, it's one of many examples the book uses to illustrate how medicine has adapted in situations where modern resources were limited. Another area the guide addresses is preparedness. It includes suggestions on medical supplies that households may want to keep on hand, especially for unexpected emergencies or temporary disruptions in services. The goal here is not fear, but preparation. The authors emphasize being informed and having a basic understanding of health situations that could arise in everyday life. The Home Doctor also contains illustrations and diagrams designed to make the information easier to understand. These visuals can help readers follow step-by-step instructions for things like wound care, physical examinations, or identifying symptoms, along with the main book. Some versions of the package also include additional digital guides. These bonuses focus on topics like identifying edible plants that grow in North America and exploring traditional natural remedies that were historically used by Native American communities. These sections are more about survival knowledge and natural resources that could be helpful in certain situations. One thing worth mentioning is that the book includes a 60-day money-back guarantee, which allows readers to review the material and decide whether it's useful for them. That can provide some peace of mind for people who want to explore the content without feeling locked into the purchase. Who might benefit the most from a guide like The Home Doctor? It could be helpful for people interested in emergency preparedness, families who want a basic medical reference at home, or anyone who prefers to learn more about handling minor health situations confidently. Of course, it's important to remember that a book cannot replace trained medical professionals, but having reliable information available at home can sometimes make a difference when quick decisions are needed. Overall, The Home Doctor aims to provide practical, easy-to-understand medical knowledge that ordinary people can keep on their bookshelf. whether it's recognizing symptoms, treating minor injuries, or simply understanding how the body reacts to certain conditions. The guide tries to make medical information more accessible to the average household. If you'd like to check it out, I'll leave the official link in the description. Thanks for watching, and see you in the next video.